Hi, so this is Violet. You wouldn't think so, but she's one of the golden old rescues. So she's not a dog, and golden old is usually rescue dogs, and she's not old because she's about 6 months of age, and she's actually here today for desexing. So I wanted to take you into the surgery today and actually walk through with me exactly what happens when a pet comes into us for desexing, and whether it's, let's park the actual surgical procedure itself and let's talk about what leads up to the surgical procedure. So whether it's a cat or a dog, a boy or a girl, essentially the protocol is exactly the same. The first thing is we do a comprehensive 14-part health check. Involves listening to their hearts with a stethoscope. Now, because she's a rescue, she's really nervous, so I can't actually put her down and let her go. She would flip out. She is so apprehensive, as you can understand. So as I said, we use a stethoscope, check her heart and her lungs thoroughly, use an ophthalmoscope to check her ears thoroughly. As well as that, we'll look at the colour of her gums. As I said, it's a 14-part comprehensive health check that's performed on every single animal before they undergo an anaesthetic procedure. That's to make sure that they are healthy enough to have the procedure. Then they're sedated. So I'm very strong on pain relief, and we actually use pain relief in 3 stages or 3 phases during a desexing procedure, or again for any procedure for that matter. So she's had methadone or morphine, whatever you want to call it. That's the stage 1 of pain relief. So she's had some methadone, and she's also had a light sedation just to take the edge off her so that she's less apprehensive. So she will then get some intraoperative pain relief, and I'll show you that as well, and then she'll go home with a pain pack. Pain is something that animals, just like us, animals do not need to suffer from or have pain associated with surgery. So she's ready to go, so I'll get my gown and gloves and cap and mask on, and I'll see you in the surgery with Violet. Okay, so we've now got Violet under anaesthetic. I'd have liked to let you in while we were doing this, but being so nervous I didn't want to be filming as we were anaesthetising her, but we'll do that at another time with another patient. Again, you can see the standard protocol here is that she's on an IV drip. The intravenous drip is standard with all our surgeries, and that does a number of things. The main thing it does is to maintain a really good blood flow to all the vital internal organs, especially kidneys. Kidneys are really susceptible to even slight drops in blood pressure. So this makes sure that the blood pressure stays high all the time, or stays where it needs to be all the time, and we don't have issues later on because of slight drops in blood pressure. The other thing is that it flushes, metabolizes the anaesthetic out of the system a lot more quickly. So she will wake up incredibly quickly from this anaesthetic and also go home full of vim and vigour as if nothing had happened. We'll now prep her for surgery, and I'll show you that, and then I'll get my gown and whatnot on, and we'll start on the surgery. Welcome back. So Kira's just done the pre-operative sterilisation of the skin. And there's 3 things we use for that. This pink stuff here is chlorhexidine. It's the same thing that I'll scrub my hands with shortly to sterilise my hands. So that's the first part of the prep. Then we have alcohol, which is the second part of the prep, and then we have iodine. So when we use those 3 things together, we thoroughly sterilise the skin so that it's a sterile surgical environment. And now we give Violet her intraoperative pain relief. So we can give it anywhere under the skin. And next thing is we're ready to operate. So I'll see you then. Okay, so here we're at the pointy end of the funnel when the surgery is actually happening. So we have a drape called a spay drape which is exactly the right size for different animals. There's a different size for each different animal. We hold them in place with towel clips, and now I'm going to make my incision, and we'll just turn the camera off while we're actually doing the surgery, so you don't have to be worried about any blood and gore, but I'll see you as we're putting the last suture in. Welcome back. The procedure's almost done. I'm just putting the final layer of sutures in. There's actually 3 layers of sutures. The internal muscles, and then the fatty layer, which we call the subcutaneous layer under the skin, and then the skin itself. So the internal 2 layers are dissolving. The outer layer is not dissolving. At the moment, I'm actually using silk. I don't always use silk, but silk's a very, very comfortable suture. It's really lovely for the patient. And using that in her. I'm reasonably proficient at desexing, and you can see the hole is only a very small hole. And so let me do the unveil for you. You can see I'm throwing the silk out, even though there's a lot of it left. We use a sterile Kira, can you grab me? Actually, I'm done anyway. So we use sterile packs, so each patient will have a sterile pack of dissolvable suture material and of non-dissolvable suture material in the skin. So whatever we don't use just gets thrown out. We don't re-sterilise it. That's not appropriate. So let me take these instruments off. And you can see what it looks like. Obviously we still have to clean that wound up, but that's it. The sutures will stay in for 10 to 14 days, and then we will we'll take them out. So that's it. I hope you've learned some things today. If you've got any question about this procedure or any other procedures, please give me a yell. We're recording this on the 24th, the day before Christmas. So I hope you have you probably won't see this till after Christmas or early in the new year. But in case you do, have a fantastic Christmas and have an awesome 2019. And I hope to see you at the practice next year. Bye.